At the recent American Heart Association meetings, I was fortunate enough to present a paper on the BARI 2D study, which is the largest study conducted to date in patients with diabetes and coronary artery disease. This study was supported by the National Institutes of Health, and the Lahey Clinic was one of the vanguard sites in this study, and in fact we actually enrolled one of the first patients in the world in this study. Basically, patients with diabetes and coronary artery disease were randomized. That means they were separated into two equal groups comparing different forms of treatment for their heart disease. One group got bypass surgery or angioplasty, a procedure where they put stents and balloons in the coronary arteries to get rid of blockages that cause chest pain, and the other groups were given just plain old-fashioned medical therapy for their chest pain or angina. We followed these patients for about 5 years and learned actually that bypass surgery turned out to be the superior treatment, which was sort of surprising. Many of these patients didn't have heart attacks, they didn't have really terrible or bad or frequent angina pains, and many doctors would consider them to be only mildly symptomatic. And yet the most severe treatment, or at least most people consider it severe, that is bypass surgery, actually turned out to be the safest treatment for these patients over 5 years. So I think this represents new information. There are a lot of patients out there with diabetes and a lot of patients out there with coronary artery disease who may not think they're very ill, at least as far as their chest pain is concerned, but when they present to their doctor with their first episode of chest pain, it may turn out that something as dramatic as bypass surgery may be their best ticket for a long, long and happy life.